Well, this segment is sponsored by the Springfield Clinic. We have a special guest in the studio, Missy Armatta from the Springfield Clinic. She's a registered dietitian, right?
Am, yes.
Talk a little bit about these glucose monitors that you guys are having.
Okay.
You guys have where at the Springfield Clinic?
Yes, traditionally and still now we use lancing devices to lance our finger and actually put it on blood on a strip to give us our blood sugar reading at that point in time. Now we have what's called continuous glucose monitors, where we take a sensor, which might look something like this, and underneath the skin is a small monofilament, and it
I love props. Let me see that. Go ahead.
And it actually tests the interstitial fluid, the blood glucose that's in it, and converts that to a blood sugar reading and sends it to an actual transmitter or to a receiver. So instead of poking the finger, and over the last 40 years, I've had type 1 diabetes, so I've poked my finger probably 43,000 times. I did the math last night.
Wow.
So it's very nice. Only as a child did I dream of having something where we did not have to lance our finger multiple times a day. So the great thing about this is that this sensor sits on top of the skin, and there's usually either a swiper or it just automatically relays to a piece of equipment, which is the actual receiver, which can be our cell phone or a device that actually would come with the equipment.
So obviously it's designed to be just less invasive, probably.
A lot less invasive.
Yeah,
so,
that's amazing.
Yes.
Yeah, awesome. So how does one get one? I mean, do you just show up and ask for one? Or?
Well, no, not exactly.
Okay. Has to be prescribed, I
yes,
imagine.
it does have to be prescribed by a healthcare provider.
Okay.
Which can be, your primary care, or if you see an endocrinologist, or even a nurse practitioner or so. If you have type 1 diabetes or type 2 diabetes, you can qualify to actually have a continuous glucose monitor.
Okay, and is it, I mean, can you feel anything when it's kind of up against your skin?
No, in fact, I have to sort of reach for mine and remember where it is. But if it's too deep, or it's in a muscle, or it's placed in the wrong place, somebody may feel it. But most of the time, you cannot feel it.
That's amazing.
And it's such a great piece of equipment because we don't have to poke our fingers.
That's amazing.
6, 8, 10 times a day.
Especially for children, like you said.
Absolutely.
Yeah, they don't like
absolutely,
that. Okay.
No.
Thank you so much for being here, Missy. I
Thank you for having me.
Yes, and of course, all that information will be on our website as well, foxillinois.com. Brittany?